Hello, my name is Krishanna Turner, and this is a video on how to take skinfold measurements. The instruments that will be used for this assessment are a caliper and a marker. The client's skin should be dry and lotion-free. Do not take skinfold measurements immediately after exercise. Also, all measurements should be taken on the right side of the client's body, and you should identify and mark all sites before measuring. The tricep mark should be made on the posterior midline of the upper arm, halfway between the acromion and the olecranon processes, with the arm held freely to the side of the body. The subscapular mark should be made 1 to 2 centimeters below the inferior angle of the scapula. Be sure to have the patient fold their arms slightly to find this mark. The chest mark is found 1/2 the distance between the anterior axillary line and the nipple for men, and for women, 1/3 of the distance between the anterior axillary line and the nipple. The mid-axillary mark is found on the mid-axillary line at the level of the xiphoid process of the sternum. An alternate method is a horizontal fold taken at the level of the xiphoid sternal border in the mid-axillary line. The abdominal mark is found 2 centimeters to the right side of the umbilicus. And the suprailiac is found in line with the natural angle of the iliac crest, taken in the anterior axillary line, immediately superior to the iliac crest. The thigh mark is found on the anterior midline of the thigh, midway between the proximal border of the patella and the inguinal crease, or the hip. Once you have identified and marked all the sites, you want to firmly grasp the skin fold, the 2 layers of the skin and subcutaneous fat between the thumb and the index finger of your left hand, 1 centimeter away from the site to be measured, and pull the skin fold up and away from the body. The tricep skin fold is made by making a vertical fold. You want to shake the skin to separate the fat from the muscle. Keep the fold elevated while you take your measure. Keep pinching the fold with your left hand throughout the entire measurement. The subscapular skin fold is made by a diagonal fold at a 45-degree angle. Be sure to hold the caliper in your right hand with the dial facing up. Place the jaws of the calipers perpendicular to the fold 1 centimeter below the fingers and halfway between the crest and the base of the fold, and release all pressure on the scissor grip while keeping the caliper perpendicular to the skin fold. The chest skin fold is also a diagonal fold. Be sure to hold the measurements 1 to 2 seconds after releasing the scissor grip. The mid-axillary skin fold is a vertical fold. Record the skin fold measurements to the nearest 1/2 millimeter. The abdominal skin fold is a vertical fold. Be sure to take skin fold measures in rotational order to allow time for skin fold to regain its normal thickness. The suprailiac is a diagonal fold. Be sure to take a minimum of 2 measurements at each site. Lastly is the thigh, which is also a vertical fold. If duplicate measurements are not within 1 or 2 millimeters or 10%, you should retest this site. Once measurements have been taken, you can calculate the average for each skin fold site. Using the client's measurements and validated skin fold equations, percentage body fat can be estimated. This table shows generalized equations that allow calculation of body density without a loss in prediction accuracy for a wide range of individuals. The 7-site formula for men includes the chest, mid-axillary, triceps, subscapular, abdomen, suprailiac, and thigh to calculate body density. The 7-site formula for women also includes the chest, midixillary, triceps, subscapular, abdomen, suprailiac, and thigh for the body density as well. Percent body fat can be estimated once body density has been determined. Two of the most common prediction equations used to estimate percent body fat from body density are derived from the two-component model of body composition, the Brozak equation and the Siri equation. Each method assumes a slightly different density of fat mass and fat-free mass. Thank you for watching this video on how to assess skin fold measurements.